Hello and welcome to Podiatry Practice Mastery. My name is Don Pelto and I have Mr. Jason Kraus here. Welcome, Jason.
Nice to be here, Don. Great to see you again.
Nice to see you again. So we were recently together at the AAPPM meeting and we were catching up, and we're going to be talking a little bit about your interest in orthotics and then your passion for practice management. So most of the people listening, everyone does orthotics, and everyone probably has an orthotic company. And so the goal isn't for people to switch over, but it's to learn how they can maybe do more orthotics and make them more part of their treatment plan and doing AFOs and things like that. So tell us a little bit about, you have a long background. So give me a 2 to 3 minute synopsis of your background, how you got experience and things like that.
Sure. I have been involved in podiatry actually going all the way back to 1979 when I got my first job out of college with the Langer Biomechanics Group and Dr. Sheldon Langer, who really mentored me both on the subjects of biomechanics, orthotics, and all of that. But at the same time, he was a very skilled business professional, and he was in clinical practice prior to opening up Langer. And he used to, it wasn't called practice management back then, didn't have a fancy title, but it certainly was, very, he was very involved in trying to improve the performance of his practice financially and used to counsel customers all the time. So I was a fly on the wall early on, sponged a lot of information, got some good technical training, and I spent a dozen years there. I left in 1991. I started my own orthotic company partnering with Dr. Langer called Benefoot. So ran that for about a dozen years, sold it, and got 100% involved in practice management consulting for about 6 or 8 years. And eventually in late 2000s, 2008, I was approached by a private equity fund to partner up with them and create what became OHI, which owned Langer, the Orthotic Group, Apex Foot Health Industries, Arizona AFO, Petaline, Diabetic Sock Company, a whole portfolio of lower extremity companies. Ran that through 2019, left, and about 18 months ago, started thinking about doing another orthotic company that really combined my two great passions of practice management and orthotics, and tried to build a kind of a unique orthotic company that tapped into both of those skill sets.
Wow, that's quite a history. Let's talk a little bit about, we're going to kind of dumb this down, because I really liked when you were talking with Dr. Langer about the practice management side of orthotics. So let's keep it real simple. Like, what are some of the mistakes and reasons why doctors don't do more orthotics in their private practice? Something real simple.
Yeah, it's a myriad of different things. Sometimes it's just really just organizational structure. They're not set up to be able to execute at a significant volume just because of the way their treatment rooms are set up or their staffing levels and so forth. As you know, orthotics, those patients usually need to come back a number of times. They sometimes tie up treatment rooms depending on casting methodology and so forth. So some practices are just structurally not aligned with that particular component of practice. I think more often, though, what it really is just understanding the patient population that could be really helped therapeutically through the use of these modalities, a good, compelling patient presentation to explain how orthotics is a conservative intervention with the chief complaint that they present with, and being able to, select appropriate candidates and present effectively. Insurance reimbursement is certainly a factor as well. Some practices are quite skilled in presenting orthotics without regard to the financial component of it, whether a patient has insurance or is a cash paying patient. The presentations are equally strong and compelling because that's good medicine. Other practices struggle with that. They do pretty well when there's reimbursement. They shy away from this expensive intervention for a cash paying patient. And again, some of that just good presentation skills may be lacking.
Now, Jason, let's talk specifically, how can a doctor, and maybe I'm just thinking about your company.
Yep.
If I was gonna, if I am a doctor, so I present all day about orthotics. I always joke, if it's free, it's easy to sell anything. Okay. In Massachusetts, nothing's covered in terms of orthotics, so everyone has to buy it. So you have to be much better at presenting things. How can a doctor get better at presenting? And how can they get more confident about learning? I've looked around, there's not really many great, I've asked people, and I'm asking you, like, I've asked some other companies that I use, I'm like, hey guys, put some online training or training for us to learn to be more confident about even prescribing them and using them. And because I think the more confident we are as doctors that these things actually work, the more confident you're going to be to offer them. Is there that, because there's not much biomechanics going on these days for us to learn more?
Yeah, I think that you hit the nail right on the head there. I think the overall educational underpinning of podiatry has changed over my 40 years. When I got started, biomechanics was, quite frankly, all the rage. It was a fairly new science that had been organized and presented and began to be taught in the schools. And some of the things to come later on, surgical skills, wound care skills, they really weren't at the forefront of podiatry, and the orthopedic management of these patients was really what was the cutting edge work that was done in podiatry practices, and well supported both in podiatry colleges and residency programs. Today, there's a great focus on surgical interventions. The surgical residencies are really, the ones that folks are chasing after, and they need to be go through that in order to get all their certifications to get on insurance panels. And so they really come into clinical practice with, I think, a fairly limited skill set with regard to how to use orthotics effectively, how to manage orthopedic patients more broadly. And I think along with that comes this confidence factor that you described that comes across the patients. If you don't really understand its value, you're not going to be able to present that effectively to patients. And I think that does limit the number of prescriptions that you'll see in certain podiatric environments.
Yeah, and so what most of us end up doing, this is what I had to do. I had to go shadow doctors, and you hope that they're good at doing DME and AFOs and orthotics, and you learn their spiel, and that's about it. Is there any other tips that you have? Like, do you guys have stuff on your website where people can learn how to explain it better or teach it better or you do it better? I don't know. Are there courses that you know of? Like, why don't you put a course on? I'll go to it. But yeah.
All right. Well, that's a good idea. I'm going to put that on my to-do list. I have lectured extensively, as have others, about this very subject. We've done workshops and role playing, and those types of things are, I think, quite effective, because there's a lot of skills, not only in presenting orthotics, but broadly influential communications, and how to do that no matter what the modality or intervention that you're recommending to a patient. There's verbal cues, there's nonverbal cues. Like, there's a lot of things that could be learned, I think, to enhance presentation skills. Specifically when it comes to foot orthotics, I really think there are great analogies that are frequently used to great success, that patients can take a fairly complicated technical product or service like foot orthotics, but be able to relate it to things like eyeglasses or wheel alignments for cars. And I think the broad understanding about orthotics in the public sphere today is much greater than it was earlier on in my career. When I used to tell people I was in the orthotics business, I would get blank stares. Now everyone pretty much has heard of orthotics. They may not understand exactly what they are, but I think it should actually be easier to present today than it might have been 20 years ago. How to do that effectively is really built on your belief and
Yeah.
confidence that it's the best thing for your patient. And when I do coaching on this, Don, I really speak to this from that perspective. If you present something to a patient that you would recommend to your mother, it's going to come across that way. This is what I would do for my own mother, and you want to give your patients exactly the exact same best service or best care that you would provide a family member, and that's just built on a belief system. I think where people trip over themselves is justifying the fee. And how to manage the presentation of the fee. I've seen lots of different approaches to this. I've seen doctors basically bail out altogether. And when I say bail out, I'm not being judgmental, but they prefer to have their staff discuss fees with patients, and they don't feel it's their place to do so. I've seen other doctors approach that in a very steady, seamless way to get patients comfortable with the fact that, yeah, this is a fairly expensive solution if you don't have insurance coverage, but in the long term, there's great value, and certainly it's a conservative intervention that might prevent the need for surgery. So, one of the things I've told doctors over many decades now is, be the doctor, don't be the banker, right? Don't worry so much about your patient's ability to pay for what you think is best for them. Just present what's best for them. And if truly they can't afford it, that they will let you know that. But your job really is to present the best solution. If you happen to think custom foot orthotics is that best solution, present it without fear of rejection. Because it comes across, and it becomes a very wishy-washy presentation when you're dancing on the head of that particular pin.
What I find is working now for me is I tell my patients, as I tell the patient, my patients usually have 3 questions. They ask, how long do they last? I say they usually last 5 to 10 years. How long do they take to make? They take 3 to 4 weeks to make. And how much do they cost? They cost $550, and your insurance doesn't cover it. And I find by kind of pre going over some of the questions that people have, you could even include, what's the biggest concern? Well, that over the counter are the same, and really they're not the same. This is the reason. So if you can tell what they call the objections or the questions that they have, I find that's the easiest way of doing it. And then it really kind of deflates everything, those main questions that they have. And I do it with my presentations that I've told you about that make it a lot easier for me, but you could do it just as easily talking. I think the key is, though, having a systematic method of when you present it to your patient. Like, what are the circumstances systematically when you do it?
Yeah, in sales, we call that objection handling. You're out ahead of those objections because those are potential pain points for a patient, or reasons for them to decline to move forward. And so, yeah, anticipating them, addressing them up front really disarms a patient. I think it also presents you as an empathetic partner in their care. That it's not inexpensive, but with a 5 to 10 year lifespan, and the fact that the success rate is in the high 90%, I think it gives patients a high level of confidence.
Yeah, I like that. I haven't included that, but I'm going to start the 90%. Like maybe I return 1 or 2 a year, and how many do I do? So I get more than 90%. For Shockwave, I use something similar. I say, Shockwave, it makes you get better 50% faster, and it has about an 80% success rate. I think people like hearing stuff like making that part of your spiel, I think really helps.
Let me give you 2 very quick stories that I think speak to this. One is a very early Dr. Langer story that I used to talk about in my lectures. When he was in practice, orthotic fees might have been $150, $200. There was no reimbursement at all, not only for orthotics, but for podiatry more broadly. And when he would present an orthotic case to an appropriate patient, and he would tell the patient, he would discuss the fees, it's $200. These are custom made for your feet, and talk about all the benefits. And once in a while, a patient would object to the cost of that. That's it's a lot of money. And his response was somewhat unique. I'm not sure too many people would have the guts or confidence to respond this way, but he would say something to the effect of, I do understand that $200 is a lot of money. And you know, I've committed myself that if somebody really needs orthotics and they truly cannot afford to pay for them, I will provide them to them as part of my pro bono work. And when he told me that story, I looked at him like he had two heads. That's crazy. He goes, ask me how many times somebody took me up on a free orthotic, which I did. And his answer was 0. And when we started talking more about how that dynamic worked, he said this to me. He said, listen, people aren't looking for charity. They're looking for confidence. And they really wanted the confidence to know that this investment that they were going to make was going to make them better. And they never took me, no one was really asking for a charitable contribution. They had not yet been convinced that the value that I was charging them was going to be delivered by the product. And no one ever took them upon it. I'll tell you another story. This was a practice management consulting client of mine, probably mid-2000s, a very busy practice, 4 doctors. I forget the number of patient visits a year, but something around 100,000 between the 4 doctors. It was a border city along the Mexican border, so a lot of the patients were immigrants that came across every day and went back and so forth. So that was the environment. And when I looked at the practice data, I saw there were prefab orthotics prescribed probably 6-to-1, 7-to-1 versus custom, which is not usual. And I asked this doctor, I said, the head doctor in the clinic said, why all the prefabs? Well, you don't know my patients. You know, they just can't afford the custom and they don't have insurance. I said, oh, that's interesting. I said, take a walk with me. So we walked out into the reception room. It was packed. There had to be about 30 people. And I asked the doctor, I said, just look around the reception room. Okay, let's go out to the parking lot. Let's look around the parking lot and then we'll come back and we'll talk. And I asked him, I said, what did you see when you looked around that reception room? He goes, I saw a bunch of people who were pretty upset that I was wasting time and they were waiting for their appointment. I said, he goes, what did you see? And I said, well, I saw a whole bunch of people on iPhones. I saw a whole bunch of people wearing $150 sneakers. I saw a whole bunch of cars in the parking lot that 1 or 2 years old. I said, really what's going on here is that your patients are deciding for themselves what they want to spend money on. It's not that they, you know, they may be, you know, factory workers or low income, but they still have enough disposable income to do the things that they think are most important in their life. Your job is to present what you think is the best solution, not to give them the cheapest solution. And if they don't want it, that's fine, you've done your job, as opposed to sort of taking away the option from them to say yes. So, you know, those are just kind of techniques that, you know, I think make you a better doctor. And I think it really does convey a strong sense of confidence in your patients that, yeah, I understand this is a lot of money, but this is also the thing that will make your feet better.
Those are great. Those are really, really good. I love the idea of, and because I think all of us do, we care. So if someone really can't afford it, first to that, we would give it for free. Or if they don't work, like if they're real pain in the butt, what do? You refund them. You're like, so if you have that guarantee, you should like guaranteeing things, it really will increase the amount that you do it. We're like, what happens if it doesn't work? Well, we'll refund you, you know, but there's a 99% success rate. But like who of us, if you send it back 2 or 3 times and it doesn't work, it's too hard, this and that, you refund it, because there's such a pain in the, you know what, that you don't want them bad mouth, and you'd rather give it, keep it, and you know, it's free. That's what I do.
Yeah, well, you bring up another, it reminded me of another story. Another one of my accounts over the years called me up and asked that very question. What is the industry success rate for foot orthotic therapy? And at that time, there was a trade association for orthotic companies. And our number was about 5% failure rate, so 95% success rate. I asked him, so why are you asking that? He was making the exact same point you make. He goes, I am thinking of offering an unconditional guarantee of satisfaction for orthotics. And again, I was taken aback by it because it was a bit of a unique idea at the time. And he said, I just think I could double my volume just by doing that one thing. I asked him, I said, what at that, this is probably going back 15 years ago. What are your fees? And his fees were about $500. And this was a Houston-based practice. It was a middle income socioeconomic area. And so it's a lot of money at that time. And I kind of picked at it a little bit more. So why do you think you could you double your volume with a guarantee? And his answer, I think, was pretty insightful. He said, it's not that they can't rustle up the $500. Their fear is that they do spend that money and it doesn't work. So if I remove that financial fear, they will find the money, and I know it works 95% of the time. I feel like I'm being a really good doctor that way. And he was right. He doubled his orthotic volume.
And frankly, we would do, I don't know, I don't know if the other people do, but it's one of those, you know how much bad press you're going to have if they're stuck with something that they really don't like and use, and it's just goodwill. Yeah.
Yeah. And today, even, it's an even more important part of practice is maintaining the reputation. Back then, there wasn't, Google reviews or Yelp reviews to expose your policies. This was just, he felt like, I know this is good for them. I know that they could gather the money if they had to, or if they really felt it was the right thing. But if I remove the risk of financial failure as well as therapeutic failure, they'll make it work and I'll make it work.
That's awesome, Jason.
Yeah.
Let's talk a little bit. I know we were talking a little bit about your company. I know you guys do 3D scanning. You do you have a little dashboard, which I think is kind of cool, where they can look at where the orthotic is in the process. And you have some AFOs as well. Now you guys are doing the balance brace as well through your company. Tell me a little bit about this relaunch of the balance brace.
Sure. I think you might remember Dr. Jonathan Moore really was out ahead in the profession of podiatry in terms of helping patients that were either at a high risk of fall or had a history of falls, just because of his practice. He just was practicing in an area that had a lot of elderly people. And I think as an intellectually curious caregiver, he started studying falls and the mechanics of falls, and there's quite a bit in physical therapy. His wife was an occupational therapist who was certified in falls management, so he was exposed to it in terms of the patients that came in, and he was also really very curious about what he could do as a podiatrist to potentially mitigate some of that risk. And that led over the early 2000s to the development of a custom molded AFO that originally was developed not necessarily as a commercial situation, but just to be able to treat his own patients with. And what he found after a number of design iterations was that, in fact, he was able to really stabilize patients that had significant postural sway problems. Really, fear of falling is another risk factor, that people who were wearing the brace were a lot more confident, and their strides were longer and faster, which are also risk factors for fall. So he was able to treat his patients, see a pretty dramatic effect. And really, I think it was through the AAPPM and his involvement there that, that's an organization that shares everything. And he was sharing his success with his colleagues, and they're like, well, how do I get some of those? Which is exactly how Langer began when Dr. Langer started making orthotics in his garage, right? How do I get these for my patients? And that led eventually to a product called the More Balance Brace, being commercially offered originally through SACEP, ultimately through Arizona AFO. And over the last couple of years that I was at OHI, he had some design improvements that he felt were important to continue the work he'd done previously, and we just never got it done before I wound up leaving the company. So when I stayed involved with Dr. Moore personally and on a consulting basis and told him that I was thinking about doing a second lab, he goes, how about those design enhancements? So we met a bunch of times and we sketched it out, and we basically feel like, you know, we've been able to put the 2.0 version of his brace together. It's called the More Balanced Brace Signature Edition. And really the enhancements are, they're simple, but they're important. We changed the outer material that the mesh, which was the outer material of the original brace. It had some nice features. It was lightweight and it was very breathable, but it really frayed fairly easily. Usually he would see patients back in a month or two, and the aesthetic of the brace was already compromised. And this is before same and similar. With same and similar now, I mean, these braces really have to last the 5 years. So we decided to go with a thin but durable leather outer, and we also have a kid skin inner liner to the brace. So the comfort level, I think, has been enhanced, but the durability greatly enhanced. So that was the first one. The second one was we changed the closure mechanism. The original brace had two fairly thin Velcro straps. We went with a much broader leather strap with Velcro laminated to the inside of that. And the idea here was that people with limited dexterity were really struggling to don and doff the brace in their homes by themselves. And so he wanted to make that process easier, and our new closure system absolutely does that.
That's neat.
Yeah, from a orthopedic perspective or biomechanical perspective, we stabilized the rear foot even more. The shell of the brace has always provided some frontal plane motion, but we've added an external rear foot post that really does add to the stabilization that the brace provides people on the frontal plane. And finally, we enhanced our contouring in the longitudinal arch. The original brace,
There was no contouring.
Yeah, it was fairly flattened, and we decided there's not a really good reason to do that. We don't do that with plantar foot orthosis. There's no reason to do that with a custom AFO. So all of those things combined has really, we think, enhanced the brace. It certainly has made it easier for patients to get it on and off with simplicity, and we think will extend the life of the brace significantly with the new materials.
Yeah, I think it'll last a lot longer. The other ones, they didn't last too long.
Yeah.
Patients liked them. They did well. Well, that's great, Jason. I think we covered a lot of things today. I appreciate your time. If people want to learn more about your lab and the reason for the animal that you have there as the mascot, how can they do that?
Yeah, so the animal is it's a flamingo, and flamingo is actually it's a symbol of balance and grace. So we wanted a mascot, if you will, that was cute and fun, and we think the flamingo checked that box, but it also does speak to what we try to achieve with our products.
Nice.
Orthotica.com is our website. My email address is jason@orthotica.com.
Mm-hmm.
And I would just maybe end with this comment about sort of when we decided to put the lab together. My partner and I, Peter Karolidis, we knew that the world didn't need another orthotic company. And the only reason why we decided to go forward with it was that we thought there's room for improvement. With today's technologies, today's digital information flow, we just thought we could build it from the ground up and make things a lot easier, a lot more transparent, make the lab a lot more accountable, and really enhance the levels of service that a laboratory should be providing its podiatric clients. So we think we've accomplished that. I think our website does a pretty good job at telling that story. And certainly if there's interest to learn more, there is a calendar invite feature on the website, and you could schedule a 15 or 30-minute call and we could tell you the whole Orthotica story.
That's great. Well, thank you, Jason. I agree. I think in our lives in general, we always have to be looking how we can improve, right? So whether it be how you do orthotics, how many orthotics, I think we don't want to get stagnant. And so it's good when you see in industries, and the problem is a lot of times when they're big, you can't change them. Kind of like getting little improvements in an AFO or anything you want to change, like working for a big hospital group. A lot of us are agile. We're small little offices, so we can change things pretty easy and try new things out. So
Yeah, and listen, technology is one of the hardest things to change because it's really the foundation of almost every business. And anybody that's been through, some of the recent EHR upgrades to cloud-based systems, I mean, it's painful. It's really hard. So labs that have been, built and rooted in old technologies, it's fairly expensive and fairly cumbersome to try to update that. We had the advantage of imagining this new business in 2021, 2022. We in the middle of the pandemic, frankly, where everything was cloud-based, and I think we learned how to interact differently and do business differently, and we built all of those efficiencies into our foundational structure. So our timing was good, and I think our tools are really designed to make a complicated process, a business process, fairly simple. And I think we're checking that box every day with our clients.
great. Thank you, Jason, for your time. Appreciate it.
Welcome. Look forward to the next one.